25,254 patients have tested negative for COVID-19 to date. More than 316 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. This is about 11.5% of people who have tested positive. Approximately 97 of the total hospitalized have required treatment in an intensive care unit. And about 56 of those individuals have required the use of ventilators or breathing machines. Tragically, we've had 34 deaths among those who have tested positive for COVID-19. To date, all of those deaths have been in adult patients. Age-related breakdowns of this data is available on our website at health.pa.gov. Now, I'm a very hopeful and optimistic person, and many people have asked me how I can remain hopeful and optimistic when life is changing so quickly. Well, I'm a hopeful and optimistic person because of the fantastic healthcare professionals, first responders, and emergency medical services who are working tirelessly to make sure that Pennsylvanians are safe. Because of our fantastic public servants under the leadership of Governor Tom Wolf, who are making sure that government keeps providing services to all of our citizens in Pennsylvania. And because of our absolutely fantastic teams here at the Department of Health and the Pennsylvania Emergency Management Agency. They are really working around the clock to make sure that facilities have what they need, that physicians are able to do the consultations that they need of sick patients, that our state lab is prepared for testing, and our staff has been on the front lines even before the first case was detected. We started our operations center at the first day of February. And I'm also a hopeful and optimistic person because of everyone in Pennsylvania. We are a strong and resilient Commonwealth, and we are the first ones to help neighbors in need. And we know that the only way that we're going to get through this is to get through it together. So thank you to everyone on the front lines and to everyone in Pennsylvania for practicing the social distancing that is necessary to prevent the spread of COVID-19. I know it is not easy, but it truly is our most important job right now. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Please cover coughs or sneezes with your elbow and not with your hands. Try not to touch your face, especially after touching surfaces, and clean surfaces frequently. Practicing these everyday preparation measures can help slow the spread of the dangerous virus, COVID-19. If you have questions about your health care, please contact your health care provider. If you need mental health resources because you or someone else that you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, stay safe. And now I would like to turn things over to Governor Wolf. Governor.
Thank you, Secretary Levine. And I just want to add my thanks to yours, the folks at the Department of Health and PEMA, and all the public servants who have been focused on this epidemic are doing tremendous work for their fellow citizens. So thank you to the good folks in state government who are doing such a good job for the people of Pennsylvania. And thank you all for joining the Secretary and me for tuning in for another of our updates on the COVID-19 pandemic. Over the past few days, the case count, as the Secretary said, has continued to climb. We're seeing more than 500 new cases diagnosed each day. And we're seeing this virus begin to rear its ugly head in every corner of our Commonwealth. Pennsylvanians need to know that this virus is in their communities, and we need to protect ourselves and others from spreading it. A typical carrier of COVID-19 spreads the disease to 3 other people. We need to work together to keep from carrying this disease to others, and the only way to do that is to limit our social contact. So please do not leave your homes unless absolutely necessary. Yesterday, I extended my stay-at-home order to 9 new counties: Berks, Butler, Lackawanna, Lancaster, Luzerne, Pike, Wayne, Westmoreland, and York. Today, I'm extending that order further to include Beaver, Center, and Washington counties. So if you live in a county under a stay-at-home order, you should not leave your home unless you absolutely must, because ultimately, someone's life depends on you staying home. We're a border state to New York, and I also want to reiterate the President's call for all people who have been in New York City to quarantine for 14 days. We need to control the spread of COVID-19 to prevent our hospitals from becoming overburdened. And we need to buy time to gather the materials and people we need to fight this disease. We're busy building an army of medical professionals to care for everyone who becomes ill during this crisis, and that includes more people to handle the surge of COVID-19 patients, as well as more medical professionals to handle regular medical issues like heart attacks and broken bones. To do this quickly and efficiently, we're temporarily lifting certain regulations. For example, we're now allowing any licensed healthcare professional to provide services over telemedicine. This will help us provide existing standards of care to many patients without having them leave the safety of their homes. And we're also allowing certain licensees to complete continuing education online or through distance learning. This is going to help cut down on their risk of infection and provide them with the additional flexibility during this busy time. We have many highly experienced medical professionals who have retired and allowed their licenses to lapse. If these professionals are in good standing, we're going to be letting them reactivate their licenses without fees and without needing to take continuing education credits. This will get doctors and nurses who have decades of experience back to seeing patients. And just to note, these retirees don't necessarily need to help COVID-19 patients to be a huge help. By taking patients who have everyday concerns, they're helping to reduce the overall burden on our medical system, and they're freeing up others to assist with the pandemic. And our medical professionals are stepping up. Over the past 3 weeks, we have received 119 applications to reactivate licenses. So I'd like to thank all these folks for helping out in this time of great need. And even as these experienced professionals rejoin the workforce, we're taking steps to make sure that the process for recent medical school graduates to begin to practice is as smooth as possible. The State Board of Medicine is working to minimize administrative requirements and to allow these new doctors the ability to provide a wider range of care during this emergency. We're also going to be waiving restrictions on certified nurse practitioners to allow them to work in any area of medicine so they can help wherever they're needed. We're going to assist pharmacists by allowing retired and inactive licensees to renew without paying fees, without taking continuing education credits. And we're reducing the burden on them by allowing out-of-state pharmacies to Pennsylvania in some circumstances. We're also going to allow medical professionals with licenses from other states to come practice here because we need all the hands we can get. Finally, we're lifting many licensing regulations across the board to extend deadlines and expedite processing. We don't want our doctors, our nurses, our physicians' assistants, and pharmacists to worry about paperwork for their licenses during this crisis. We want them to focus on healing the sick. So I want to thank all the medical professionals who are responding to this crisis. And I want to remind all Pennsylvanians that the best way to thank doctors and nurses is by staying home. Every case we prevent of COVID-19 by staying home is one less point of stress on our healthcare system, and it's one less opportunity to share COVID-19 with more people, further reducing that burden. If you infect 3 people, and those people infect 3 more, that's 9 patients. You go 5 links down this chain, and there are 243 people infected. So be the missing link. Remove yourself from this chain and save lives. By working together to destroy these chains of infection, we can get through this crisis with a lower loss of life and a smaller impact on our economy. So as Secretary Levine said, please stay home, stay calm, and stay safe. Thank you. And now, April, back to you for questions.
Thank you, Governor. Our first question is for you from the Center Daily Times. What went into the decision to add Center County to the stay-at-home order? They're saying there are 15 cases, so they were not quite expecting to be part of the order yet.
Others were. What we're trying to do again in expanding this is to do this in a measured way and expand the stay-at-home order to places where we're concerned, and the people in Center County, many of whom are concerned that this is getting to a point where we really need to do more than we've done in the past. So the stay-at-home order in Center County was applied there as it was in other places because we think the need is there to up the game and to make sure that people are staying home and that we're doing even more to keep ourselves safe, to keep ourselves from infecting other people.
Governor, from the Morning Call and PBS 39, they have questions about Easton Hospital, getting $8 million in emergency funding for next month and the plan for moving forward after that.
The plan, the bulk of this is coming from the federal government. There's and I think everybody is still trying to figure out exactly how that $100 billion from the federal government this to be applied to hospitals is going to be spent. In the meantime, there are places like Easton Hospital that is in financial jeopardy. Right now, the state is doing everything it can to make sure that we are increasing our healthcare capacity, not reducing it. So as part of that game plan, we're working with the Easton Hospital and the folks there to make sure they have what they need to stay open so that they can, like all the other healthcare professionals, we have a all hands on deck focus here in dealing with this epidemic, and that's what we're trying to do.
Governor, from KYW, what is your response to the president's comments that he wants to see packed churches by Easter? With people thinking about their Easter and Passover family gatherings next month, is this safe?
Well, I think what he's expressing, and I don't want to speak for him, is that we all would like to get through this as quickly as possible. And with these great holy days coming up soon, I think he's expressing the hope that we could move quickly. I think all of us, including the president, recognize that what we need to do is make sure that we're safe. And that when we get to the point where we can all get back together and enjoy each other's lives and enjoy holidays, before we can do that, we've got to make sure that we have addressed the challenges of this disease. So to the extent that we'd like to do this as quickly as possible, and that's what he was expressing, I agree with him.
The next question, Governor, we'll start with you and then go to Secretary Levine. From PBS 39, New York is in a dire situation. Should we be concerned about infections spreading to the Lehigh Valley and Poconos from people fleeing New York? And has the health department seen any evidence or confirmed spread because of that? We'll start with the governor and then go to Secretary Levine.
No, that's an important question. We have not, but it is a concern. If you look at those PennDOT signs on areas where Pennsylvania and New York abut, you'll see that we're saying, if you're coming from New York City, you need to quarantine yourself for 14 days for whatever reason. There have been other concerns expressed in different ways, and we've run them down. At this point, We don't think that this is a big problem. We have stopped regularly scheduled buses that are coming from New York to destinations in Pennsylvania, and we will continue to look at this situation. But at this point, I think what we all need to do is, whether you're coming from New York or someplace else, if you're coming to Pennsylvania, stay home. If you don't have to interact with other people, don't. And that's how we're going to stop the spread of this disease.
Comments that people coming from New York to Pennsylvania, the prudent thing, as per President Trump and the governor just reiterated, is for them to quarantine for 14 days. It's hard to determine exactly whether we have seen any cases that have spread from New York, because again, what we're seeing now is primarily community spread, and we're not able to track each individual case to trying to find out how each patient was exposed. But the prudent thing is for people to quarantine if they're coming from New York City, and to echo the governor's comments, please, everyone, especially in those counties that have been designated stay-at-home counties, people need to stay at home.
Secretary, ABC 27 and News Talk 104.1 have some questions about recovery and why is the state not keeping record of those who recovered from COVID-19?
Well, thank you for that question. We've had that question a number of times now. So epidemiologists, our public health scientists, really feel that the recovery rates for COVID-19 will not be clear until the outbreak is actually over, and they can examine all of the data from Pennsylvania and then throughout the United States. Much of the data from recovery rates is actually from China, who has certainly passed the peak in terms of the infection they've seen at this time. And what that data indicates is that most people indeed do recover from COVID-19. We'll know more when our outbreak is over.
Secretary, from WGAL, with the FDA approving new tests that can get results in under an hour, how soon will those tests be available in Pennsylvania?
I think those tests will be very, very productive and helpful, particularly in emergency departments where they might be able to do that more rapid test and then find out immediately whether a patient that's presenting to them has COVID-19. So we'll be looking forward to seeing more of those tests coming to Pennsylvania, especially, again, to be deployed in the emergency departments.
Secretary, from WNEP, have the recommendations changed regarding who should be tested? Is it still only for those who are in higher risk categories?
So the priority for testing is for patients who have symptoms. So you do not have to be in a high-risk category to be tested, but we're not testing patients who have no symptoms whatsoever. Of course, within that testing group, we are prioritizing seniors and those with chronic medical conditions, those who might be in a vulnerable population, such as a long-term care living facility, a nursing home and such, and then also healthcare workers because of the exposures that they would then give to other people. But other symptomatic patients can certainly be tested, especially if they're having significant symptoms. To do that, you should call your healthcare professional, discuss whether it's prudent to get tested, and then many hospitals and health systems throughout the state have set up testing facilities to have those swabs taken and then sent either to the hospital's laboratories or to the commercial laboratories.
Secretary, from the Bucks County Courier-Times and News Talk 104.1, they're asking about positive case numbers seem to be consistent over the past few days. Is this encouraging since the spike to 1,000 cases a day hasn't yet to occur? Mm-hmm. And is it a good sign that the virus might be slowing down? Well, we have observed that, and we're watching that data very, very carefully to see if this is a consistent trend. So it's too early to draw conclusions at this time. We'll be taking it day by day as we examine the data. Governor, we have a question for you. From WNEP in Scranton, we've heard several people who work at warehouses and other businesses that are allowed to stay open, and the folks who are working there may not feel safe. What courses of action are available for those employees?
Well, as a former employer myself, a business person, the employees should make known their concerns to their employer. It is important that some businesses stay open, the essential businesses that we depend on to stay alive during this crisis. But we've got to make sure that we're treating, everybody is treating our employees well, and keeping them as safe as we possibly can. So I would hope that the employees would share their concerns with their employer, and the employers out there would respond in a constructive fashion.
And Governor, from NBC News, there's a follow-up to some questions about travel restrictions. Have there been any continued conversation about limiting or blocking transportation from Pennsylvania to New York City or New Jersey, or in the opposite direction?
No.
Secretary.
At least.
Secretary, from Spotlight, PA. The data analysis show that Pennsylvania is in the middle of the pack among U.S. states for testing per capita, with about 0.2% of our population tested. Is that sufficient?
Well, it's been only 3 weeks that we've been able to test at all, and so we have ramped up significantly. First at our state laboratory, then at hospitals and health systems, now often using their own laboratories to do the laboratory analysis, and then with Quest and LabCorp being able to test. In addition, we still have the 2 mass testing sites, one in Philadelphia and one in Montgomery County, that are doing hundreds of tests per day. So we have been able to significantly improve our testing capacity. We will continue to do that, especially with our excellent hospitals and healthcare systems, sending more and more tests again to their own labs or to commercial laboratories. And we look forward to being able to have testing for any symptomatic patient in Pennsylvania that needs it.
Secretary, from the Daily Item in WGAL, some questions about testing. First, about the return of false negatives and positives. Is there a rate for that? And then the second, is there a backlog of tests at commercial labs?
So any laboratory test can have a small rate of false negatives and false positives, but the rates for the COVID-19 tests are very, very small. So we have complete confidence in the testing process, whether at our laboratory, at the hospital and health system laboratories, or at commercial laboratories. And the second question again?
In terms of I apologize. In terms of progress on the backlog for commercial labs?
Well, we're in constant contact with Quest and LabCorp. We're continuing to get results from those facilities, and we expect that any potential backlog they'll be able to work through presently.
Secretary, from WTAE and Penn Live, questions about masks. Do you expect to see any change in CDC guidelines when it comes to masks? And are those homemade masks going to be helpful for healthcare providers?
Well, there is no change in the CDC guidance at this time, but I know that they're looking at the issue, and we'll be continuing to look at that issue, and we'll certainly update the public if there's any change.
Secretary, from KYW, how are Pennsylvanians doing in terms of social distancing? Could we get to a point of enforceable quarantine?
Well, so there's actually evidence that Pennsylvania is doing quite well in terms of social distancing. There have been a number of analysis of social distancing in many different states, and they would give a grade to that state. And Pennsylvania got an A. I believe the governor referenced that a number of days ago. So I think that the governor has taken a very measured and stepwise approach in terms of instituting the stay-at-home order according to the conditions in each county and the number of cases, but also the rate of change of cases. We are in close contact with the county commissioners and officials in each county and are listening to them about what the needs that they see in their home counties. And so I think that we're doing a very good job in social distancing. I see no other changes at this time, except we will continue to implement social distancing in counties according to the situation on the ground at those times, and that will be something we evaluate continuously.
Governor, the next question is for you. We have a similar question from Penn Capital Star and PLS Reporter about the federal stimulus package. Now that Congress has finalized the relief package, do you think that lawmakers will have to return to Harrisburg to authorize more relief measures? And what are you thinking about spending that money on?
Well, we're still trying to figure out as late as just a few hours ago at our daily staff meeting what exactly is coming to Pennsylvania. So we're working with government relations folks in Washington and our representatives in the House and the Senate to try to figure out exactly what is coming to Pennsylvania and when it's coming. There are a lot of different buckets, and so we believe that in different formats, state and local governments will get somewhere around $5 billion, but that's going to be allocated in ways that have yet to be made known to at least us in Harrisburg. So we'll keep watching that, but certainly appreciate the timely action on the part of the federal government to help with this. As you know, and as I reported in my last press conference, the state is also doing things independently and has authorized the expenditure of $50 million. We've set up, in addition to that, special low-interest loan funds in PETA at the Department of Community and Economic Development. We're waiving all kinds of administrative things in our licensing procedures, but also with our unemployment compensation. Unemployment compensation will be getting some money from the federal government. The expansion of Medicaid and increased funding for Medicaid will come from the federal government. So we're still trying to figure out exactly what Pennsylvania is going to get from the federal government in terms of the stimulus. But we're heartened by what we're seeing early on.
Secretary, the next question is with you. From News Talk 104.1, with additional counties now under stay-at-home orders, what is the case threshold or indicators that lead to the issue of these types of orders?
Well, there are, as I mentioned just a couple of minutes ago, there are a number of different factors that we use. We look at the number of cases in that county, but also in contiguous counties. We look at the rate of change in terms of new cases, but then we also consult with the county commissioners or the county health authorities about what they're seeing in their counties, and then together we discuss that at the senior staff meetings, and in the end look to the governor for a decision about closing or the stay-at-home order in each county. So it's not one factor, it's a whole number of different factors put together in order to make that decision.
Secretary, from the Post-Gazette, do you have estimates on how many ventilators the state will need if the state will have the supply to meet the demand?
Mm-hmm. So we are working on that all the time. So we have had a number of modeling studies that we've been looking at. So the Department of Health doesn't have its own modeling. We have actually asked the University of Pittsburgh School of Public Health to use their FRED model, their FRED model, to look at that in Allegheny County and throughout the state. That model actually was published, some results were published in a newspaper. We also have seen modeling studies and discussions with the University of Pennsylvania, and then there are some national modeling studies. They all use different types of statistics. They have different criteria for how they produce their models. So, and a lot of them depend, in terms of what the necessity will be, on how much social distancing we are able to accomplish in Pennsylvania. The prevention and mitigation strategies that the governor has implemented in terms of schools, in terms of non-essential life sustaining businesses, and then now the stay-at-home orders. That is actually key. And so often the models will show that if you've been able to do social distancing, it's a rate, and then if it's not social distancing, it's a much. If there isn't social distancing, there's a high rate, and if there is, it's a lower rate. So we've been looking at all those models really, really carefully. Right now, in terms of ICU beds, there are 3,400 licensed ICU beds. 40% are available. so we have no shortage of ICU beds. In terms of ventilators, we've actually found some more ventilators, so there's well over 4,000 ventilators available across the state. Approximately 75% are still available. We're working on all aspects of our health care response, including space and beds, staffing, supplies, including ventilators, and then emergency standards of care. So all of that goes into our calculations. If we are able to successfully prevent and mitigate the steep rise of cases, that peak of cases, then we will certainly have enough capability in our healthcare system to deal with the small wave as opposed to the very large wave.
Governor, the last question is for you from ABC 27. Are you and the legislature looking at retooling the proposed budget in light of the economic impact of coronavirus? And will Pennsylvania need to dip into the rainy day fund?
We have not gotten to the point of deciding how we're going to do this. I think a lot of the financial conversation to come will depend on what we end up Pennsylvania ends up getting, and what these buckets are from the federal stimulus package. At this point, we don't know enough to sit down and have reopen the budget conversation, but that's something that is very possible that will be coming. Let me just add, before we leave, to something that Secretary Levine said. All these models of what the healthcare capacity has, what we're going to need in terms of protective equipment, of ventilators, of beds, of gowns, things like that, really all comes down to assumptions that are made about what the need is. And the need is going to be determined by how well we as Pennsylvanians do to keep the infection rate down. And that means doing the things that we're doing right now. Social distancing, stay at home, the things that we're trying to do to protect each other and protect ourselves. If we're successful, then we're going to have enough. If we don't do this, if we shirk our duty to each other, then we're not going to have the capacity to deal with the problems that are going to loom in front of us. And the most pessimistic models are going to be the ones that end up having the day. We need to make sure, again, this is just one more way of saying, we have it within our means, within our hands, to keep Pennsylvanians safe by making sure that we have the capacity in our healthcare system to deal with the crisis. So the Secretary was absolutely right on that. So thank you again for joining us, and April, back to you.
Thank you, Governor. That concludes our briefing for today. For reporters whose questions we were not able to get to, we will follow up today from the Department of Health and the Governor's Office. Please stay tuned for our next briefing tomorrow.